Well, good morning, everybody. Welcome back to the program. So many things in Western New York we remind ourselves daily we can be proud of, and I think Aesthetic Associates is another one of those things because Dr. Todd Shatkin has literally traveled all over the world teaching procedures that he started right here in Buffalo. And they have labs on premises, everything. We welcome Dr. Todd this morning.
Thanks,
Doctor,
John.
thanks for being with us again this morning.
Thank you.
You're looking very summery with your top
Well, it was pretty warm and humid today. I didn't really want to put a shirt and tie on.
Yeah. I want to go back and reiterate something. There are procedures that you developed at Aesthetic Associates that you literally have gone all over the world teaching in other countries, teaching these people how to do these procedures.
Yes, I patented the mini implant crown and bridge technique back in 2003. I can't even believe it's been almost 10 years since
Isn't that incredible? It seems like yesterday.
And yeah, I traveled to Asia, to Australia, to Europe, South America, you know, all over the world. And it's been a lot of fun because I've gotten to see the world and also been able to teach while I'm there. Right.
And besides on-premise labs, you have converted the second floor of Aesthetic Associates to a training center, haven't you?
That's right. So instead of traveling around the United States like I used to, I bring the dentists right to Buffalo. So we bring 30 to 50 dentists at a time. In fact, last weekend we had a little over 35 dentists here visiting from all over the country, and we train them right there. And it's better because not only can we give the lecture portion, but we also do the live surgery, and they get to watch on a big screen while I'm working on a patient, and they can communicate with me and ask me questions during the procedure.
Oh, that's tremendous. That's a great idea, and certainly saves you from having to make a lot of odd trips.
Right, and you know, my kids are still young and I want to be around, you know, when they're here. So
yeah. Now, you brought a patient with us this morning.
I did.
Her name is Jackie. Jackie, thank you for being with us this morning.
Thank you for having me.
And for being with the doctor. I hope we're not keeping you from your job too long.
Oh, that's okay.
She's here, boss. She's here. She's not goofing off.
That's right.
What are we talking about this morning, doctor?
Well, Jackie, at a very young age, lost all of her teeth because of dental decay, and maybe she can tell you the story.
Yes, I had a major fear of dentists, and coupled with not having a lot of dental insurance, I kind of stayed away, and that caused my teeth to decay to the point where they were no longer saved.
Okay, and so then you obviously had to go to dentures.
Correct.
And as many people today with dentures, you probably bought tubes and tubes and tubes of this glue.
Tubes and tubes, very hard to eat. They would loosen up, was not happy, and I thought there's no way I could go on the rest of my life like this. So when I seen Dr. Shatkin's commercial, I thought, let's take a look at it.
Yeah, well, why not go to the man that fathered the process?
Exactly.
I mean, that makes a lot of sense. Well, was it a pretty long, involved job with Jackie, doctor?
No, in fact, I think it took us about an hour to stabilize the upper and lower dentures. We put 6 mini implants in the upper denture, 4 on the lower, and now she snaps them in. She's got the palate completely removed from the roof of the mouth, and she can eat anything she likes.
Oh, that's great. So up till now, or up until the procedure,
right.
Apples, corn on the cob, things like that were
Could
just
not.
no. I mean, that was
absolutely not. Now I can have corn on the cob, bite an apple.
Yeah. Well, that's wonderful. That is great. How long did it take, Jackie, from the first visit to when you were finally done? Do you remember the span
the first visit? It was only a few weeks. I mean, he got me in right away. Didn't leave me time to back out of it.
Yeah.
The interesting thing is you heard about me on AM Buffalo.
Yes, I did. I actually had a day off, was watching AM Buffalo, and I seen the commercial. I'm like, let's give him a call, free consultation.
Yeah.
Let's see what he can do for me.
Oh, that's wonderful. That's great. Well, you must have overcome that fear long enough to come see Dr. Todd.
Yes.
Can we have those?
Yeah,
we'll
let me see those models here.
We'll just take them right here. And you brought some models.
Yeah, I wanted to show people exactly what Jackie had done. So on the upper, she had a full plate, and I don't know if they can zoom in on this or not, but
I think they can.
This is the upper denture here in my
use number 2.
Yeah,
right there.
in this hand is the denture now type of denture that she has without the palate. So we're able to take the complete palate out, and we put these little mini implants in. And you can see them here on this model. And then inside the denture, we put these little rubber O-ring gasket type things, and then they just snap right in.
Isn't that incredible?
And so this would be her mouth, and this is the teeth, and they just snap on, so you don't have to put any glue in or anything, and you can really eat anything you want, corn on the cob,
Take
apples.
those apart again, doctor. I want to ask you something. How important is it for the patient to have that opening so they can feel the roof of their mouth?
You can actually taste. You feel hot and cold. A lot of your taste is bad because you lose a lot when you have the upper palate closed.
Right. Now, doctor, do we ever have to worry about the contact and the snapping ever loosening?
Well,
And if it does, is that easy to
That's a great question, John. What we do is we take these little O-rings out once a year, and we put new ones in.
In the denture itself?
Right in the denture itself. And it just takes about a 5-minute procedure in the office. We snap the O-rings out, put new ones in, we clean their dentures and check their implants, and then they're on their way.
That's incredible.
So once a year we replace it. And we do the same thing on the lower, which is what we did for her on the bottom. Same idea, a lower denture, again, very similar to the upper, and that also snaps into place.
Yeah, you can actually hear the snap. All right. That is.
And so this has really literally changed the lives of thousands of patients around the world, hundreds of thousands.
Yeah.
And again, the procedure itself is very minimally invasive because we don't do any cutting, there's no surgery, there's no stitches. We just make a very small pinhole in the gum, thread the implant into that little hole, and then we can stabilize their dentures.
We emphasize how minimal the invasion is in the mouth with the mini implants.
Yes.
That leads me to believe there must be a massive invasion if you go with the old traditional implants.
Well, we like to call it the big hole, little hole.
Okay.
With the conventional implants, we have to make a large hole in the bone. And in order to do that, you have to reflect tissue so you can visualize the bone. Otherwise, you could drill outside the bone.
Yeah.
So, and oftentimes, there's not enough bone to even place those large holes in, and you have to build up the bone with bone grafts and sometimes sinus lift procedures.
So we're talking a lot of time.
It's a lot of time, it's a lot of surgery, and it's quite a bit more invasive. And it's more expensive as well. And this is about half the cost of the conventional implants.
And you're telling me the mini implants came into being back around 2003?
Well, they started being on the market in the right around 2000 for stabilizing dentures, and then in 2003 I developed a procedure to use these for crown and bridge as well, which is basically this procedure here where we actually can replace a single tooth.
Oh, look at that!
A single missing tooth with a mini implant. And that gets cemented on. And we can also do a quadrant of teeth like this. If someone's missing 3 or 4 teeth, we can replace those with implants, and then we cement the crowns on.
So it doesn't have to be the entire mouth. It can just be 1 tooth, 2 teeth, 3 teeth.
Right. So everybody you know, almost everyone you know is missing 1 or more teeth.
Sure.
And they, instead of having permanent bridge work and having to grind down their healthy teeth to put a tooth in, we can do a mini implant in one or 2 visits and replace that tooth.
Okay, we're going to take a break and we'll be right back. But when we come back, we want to take your phone calls at 644-9840. It's your opportunity to talk with the doctor about a very important part of your body, your mouth. So stay with us. We'll be right back. All right, folks, this morning we are spending some time with Aesthetic Associates and Dr. Todd Shatkin, and we're appealing to people who either know they're going to lose their teeth, have already lost their teeth, or you're dealing with dentures that don't fit and don't operate properly. You are with the expert this morning. Dr. Todd wrote the book on mini implants. He developed the procedure himself. He teaches the procedure all over the world, although recently you've kind of got the world coming to you, I believe.
I'm trying to help the Western New York economy by bringing people to Buffalo.
There you go, and they're coming from all over the place. We have a phone call, if you don't mind taking one. This is Marty from Cheektowaga. Good morning, Marty.
Good morning.
Hi.
Hi. I've grown up with gaps in my 2 front teeth most of my life. I'm about 41 now, and I would just like to have a nice, straight smile. Would you recommend, like, 2 individual tooth implants, or would you just say that going for the crowns would be okay? I mean,
If you just have a little gap between your front teeth, a lot of times we can do porcelain veneers, which will just veneer the teeth and close up that gap. It depends on how large the gap is. If it's really large, you may have to have crowns done on the two teeth. But normally, for cosmetic purposes, we wouldn't extract the teeth and put implants in. We'd rather save the teeth and put something over them to improve the cosmetic appearance.
Well, because one of them is actually a porcelain attachment that was never crowned properly. I had hit my tooth on a water fountain in high school, and it cracked at the gum line.
Okay, so you might need a crown on that one if it's had a chip or a break on it. But because you called and because you're listening today, I'm offering you a complimentary consultation. So if you want to come in, I can take a look at your teeth and really give you a little better idea of what I think should be done for you.
Oh, cool. Thank you.
All right. All right.
You know, it occurs to me that with this procedure, you're offering people hope that never really had any hope whatsoever.
Yeah, you know what the great thing about doing these procedures is, as a dentist, these patients are very gratified. And they come back and they appreciate what you've done for them, and they tell you their experiences. For example, yes. Jackie's got a picture.
Oh, I love this.
Jackie's has gained self-confidence.
Yes, my self-confidence has definitely increased. And
let me hold this up so they can see this.
Gave you the confidence to go meet.
This is a picture of Jackie, and we'll get a little close-up of Jackie and Brett Michaels, of all people. She wasn't afraid to have her picture taken with this famous guy. And there they are. Look at that.
Yeah.
What a lovely couple. They make a nice couple.
They do. They almost look like they're a couple.
When was that picture taken, Jackie?
Last summer at Darien Lake.
Oh, that's great.
Yes.
That's great. When did you have this all done, Jackie?
Just over a year ago.
All right. And everything has been smooth and operating beautifully.
Very smooth. The procedure took less than an hour. Within the next day, I was eating again. I was actually surprised, very surprised, pleasantly surprised.
Yeah. Doctor, we have another call. Good morning. Welcome to the show.
Good morning.
Hi there.
How you doing?
We're okay.
Doctor, I wanted to ask you a question. My wife's got periodontal, and some of her teeth are kind of bad, and she's very sensitive to dentistry, anybody touching them, and I would like to know if she's better off getting the entire crown done where you put what Jackie's got, or if she's better off getting one tooth at a time, and if it's a costly procedure.
Well, you know, every case is different, so it's hard for me to tell you exactly what your wife should have done, but I will tell you that if she's got a fear of the dentist and she's not excited about going multiple times to the dentist, the best thing for her would be to come in and we do IV sedation. We bring our anesthesiologist in, an MD anesthesiologist, Dr. Rose Birkin, will come in, put the patient, you know, sedate the patient so that they don't remember anything. They're in la-la land. We'll do all the dentistry all at once in one longer procedure, and then they wake up and their teeth are pretty much done. The next visit they come in to have the permanent teeth put in, but that's not a painful or uncomfortable procedure. So if your wife has this fear and doesn't really want to spend a lot of time in the office, that's probably the best way to do it.
Well, can I ask you another question? Would it be possible for her to come in and, like you said, get a consultation from you?
Yes.
And see what you think and what the best procedure would be from there?
Absolutely. If you call our office at 839-1700, somebody there will be happy to make you an appointment. I'm offering complimentary consultations today, so anybody who's listening can call up, and we'll be happy to see you and give you a free consultation and advise you as to what I would recommend, and then it's up to you to decide what you want to do.
I think that's great. I think you really helped this person out.
I'm happy to.
Doctor, are you telling me that once you put the implant, the studs or the anchors in, they have to live with that for a day or two before you put the dentures in?
No, we put teeth in immediately.
Oh, immediately, okay.
When we put the implants in, sometimes we put temporary crowns on them for a week or two while we're making the permanent crowns, and we take impressions. Otherwise, if they have their existing dentures, we stabilize those immediately. Nobody ever leaves our office without teeth. That's something that I just don't allow.
Okay. And
we want the patients to leave smiling.
You answered one question I was going to ask about the sedation. You hear so many commercials about, you just take this one little pill and you wake up and everything. I don't know if I've ever taken a pill that's ever knocked me out completely.
Well,
but you do this IV.
There are some pills that you can take, but I'm a little concerned about some of those, to be honest with you, because monitoring the patient is really, really critical. You know, you don't know, everybody reacts differently to medications, and somebody may react more heavily to a pill than others, and if you're not monitoring their blood pressure, their pulse oximetry, their oxygen, you know, in the blood, you could run into issues. So we do our sedation, but we use an MD anesthesiologist, Dr. Birkin. She comes in, you know, she's, you know, a fully certified medical doctor, and she does a fantastic job.
So, Jackie, was the doctor able to work with the dentures you came in with, or did you have to have new ones made?
At first, he worked with the ones I already had, and then I came back and we did the ones that he has there where the upper palate's gone.
Wow, I tell you, you'd never know. You'd never know.
They really look natural on her.
Yes.
Are beautiful. We had some befores and some after pictures and so forth. I don't know if we still have those that we can put up.
Yeah, that was another. That's a gentleman
right.
patient. You can see the decay down by the gum line on all the front teeth. These teeth were actually decayed all the way through the tooth, so they weren't able to be saved, unfortunately.
Yeah, that's
and
another
we went ahead and extracted all those teeth and made upper and lower implant dentures. And this is with his cheeks retracted, but with him smiling naturally is the next picture. And that's, you know, that's what he looks like now.
That is incredible. You'd never know that wasn't the person's natural teeth.
Yeah.
They've really done. They've done some amazing technology.
And we have a wonderful technician. His name is Jim, and he makes all the dentures. He and his son, and they do a fantastic job.
Yeah. So, Jackie, I would imagine you are a walking commercial for Dr. Todd Shatkin now, aren't you? Do you have any friends that you might be going to see him?
A couple friends. Actually, a friend's mother actually had called to ask me some questions. I do believe she did go to see.
Great.
Yeah,
great.
We
That's
appreciate
what we want.
it.
Dr. Todd, Jackie, thank you so much for being with us today.
Thanks for having us.
You've really opened our eyes and amazed us once again with the amazing technology in the field of dentistry and the fact that you don't have to be afraid anymore. Aesthetic Associates Center and Dr. Todd Shatkin can be found at 2500 Kensington Avenue in Amherst. 839-1700 is their phone number, and gr8look.com is the website. You can really find out everything there.